Hey everyone, if you're dealing with PCOD or PCOS, or maybe you know someone who is, you are in exactly the right place. Today we're going to break down the simple, natural steps you can take to manage these conditions and really reclaim control of your health. So let's get right into it. So here's what we've got on deck today. We've got a really clear 5-part plan. We'll start by making sure we understand the basics. Then we'll dive into the 3 pillars of managing this naturally. That's your diet, movement, and some awesome home remedies. And then we'll finish up with something super important when it's time to bring in an expert. You know, the first thing I really want you to hear is this. You are definitely not alone. Millions upon millions of women all over the world are going through this. And I know it can feel so overwhelming, but the good news is there are clear, manageable steps you can absolutely take. Okay, so this is probably the most common question we get, and it's a really good one. People use these terms PCOD and PCOS almost interchangeably, but they are not the same thing. And understanding that difference, well, that's your first big step toward managing it effectively. So let's dive into our first section. We're going to build a really solid foundation by getting to the bottom of what PCOD and PCOS actually are. All right, let's break this down. With PCOD, think of it this way. The ovaries sometimes release immature eggs, and those can turn into cysts, which then messes with your hormones. Now, PCOS, that's a bit more complex. It's actually a metabolic disorder, which means it affects how your entire body uses energy, and it's often tied to something called insulin resistance. So think of insulin as the key that lets sugar into your cells to be used as fuel. With insulin resistance, those locks on your cells get kind of sticky. Your body has to pump out more and more insulin just to get the door open. And all that extra insulin is what really throws your other hormones way out of whack. So the key takeaway? While both involve the ovaries, PCOS is a more serious, body-wide issue. This is the million-dollar question, isn't it? The one on everyone's mind. And while there might not be a magic cure, the symptoms can absolutely be managed. They can be reduced, and in a lot of cases, they can be pretty much eliminated just through lifestyle changes. And here's just how possible that is. Get this. Research actually shows that losing as little as 5 to 10% of your body weight is often enough to help get your menstrual cycle back on a regular schedule. See, this isn't about some drastic, impossible transformation. It's about small, sustainable changes that can have a huge, huge impact. And that leads us perfectly into our first real pillar of action, your diet. Seriously, this is the foundation for everything, because what you put in your body has a direct line to your hormone levels and your insulin sensitivity. So what should be on your plate? Well, the big goal is to focus on foods that are low on the glycemic index and have anti-inflammatory properties. Things like whole grains, all those leafy greens, fatty fish, they help keep your blood sugar stable. And that's so crucial because it stops those big sugar spikes that make your body produce all that extra insulin we just talked about. It just helps keep your hormones in a much happier balance. And on the other side of the coin, what should we maybe try to limit? The main things to watch out for are the ones that can spike your blood sugar and cause inflammation. So yeah, we're talking about refined flours like white bread, sugary sodas, deep-fried foods, and all those heavily processed snacks. And for some people, cutting back on excessive dairy can also make a real difference. And just to show you how this could look in real life, because it's not as complicated as it sounds, here's a quick sample day. You could kick things off with some oatmeal and berries, have a lunch with grilled chicken or paneer and some brown rice, maybe a healthy snack like roasted chickpeas, and then finish the day with fish and a veggie stir-fry for dinner. See, it's all about balanced, whole foods. Okay, pillar number 2, and this one's a biggie, movement as medicine. This is not about punishing yourself at the gym, it's about using physical activity to help your body heal and regulate itself. It's powerful stuff. The magic number to keep in your head? 150. That's the recommended number of minutes of moderate exercise per week. And you can totally break that up however you want, like 30 minutes 5 days a week. It's a really manageable goal. And you know, the best plan is usually a mix of different things. Cardio is fantastic for improving insulin sensitivity. Strength training helps build muscle that burns more calories. Yoga is incredible for balancing hormones and just chilling you out. And HIIT, that's high-intensity interval training, is a super efficient way to give your metabolism a serious boost. All right, moving on to our third pillar. So, alongside your diet and exercise, there are a few simple home remedies that can act as these awesome natural boosters for your whole health plan. You know, some really simple ingredients can make a surprising difference. A little cinnamon can help with insulin sensitivity. Fenugreek seeds can help balance out your hormones. And even sipping on some spearmint tea has been shown to help reduce excess male hormones, or androgens. Now, when it comes to supplements like inositol or vitamin D, this is super important. You have to talk to your doctor first before you start anything new. Seriously, don't skip that step. And that brings us to our final and honestly one of the most important sections. These natural methods are amazing, but it is just as important to know when it's time to bring in an expert. Reaching out for professional help is a sign of strength. It is not a sign of failure. So, when is it time to pick up the phone and make that appointment? Well, if you go for several months without getting a period, that's a big one. If you're trying to get pregnant and it's just not happening, or if you're experiencing any kind of severe pain. And also, if you've been really consistent with all these natural methods for, say, 3 to 6 months and you're just not seeing any improvement, that's another key sign that it's time for some professional guidance. You know, a really good doctor isn't going to dismiss all the hard work you're doing. They're going to integrate it. I love this quote from Dr. Saraswati Ramesh because it just captures that perfect approach, one that combines the best of natural, preventative medicine with advanced medical care. And this whole idea, this is what we call holistic care. It's all about looking at the big picture. It means treating the physical, the mental, and the emotional parts of your health all at the same time. Because, well, they're all connected. And please, remember this. Taking control of your health, it's a journey. It is not a destination. There are going to be good days and there are going to be challenging days. The goal is not perfection, it's just progress. So be kind to yourself and celebrate those small wins along the way. So I'm going to leave you with this question to think about. It doesn't have to be some massive, life-altering change. Maybe it's just adding a sprinkle of cinnamon to your coffee this morning. Or maybe it's going for a 10-minute walk on your lunch break. What's that one small change you can make today to get started?